Olá, este é o Poder Entrevista, eu sou o Tiago Mali, editor sênior do Poder 360 e vou entrevistar Jamie Hartamann-Boyce, pesquisadora, professora de políticas na área de saúde da Universidade de Massachusetts. Jamie é autora de uma revisão de 88 estudos a respeito do uso de cigarros eletrônicos como suporte para quem quer deixar de fumar. A pesquisadora tem doutorado pela Universidade de Oxford e é editora, uma das editoras da biblioteca Cochrane de bancos de dados médicos. Esta entrevista está sendo gravada no estúdio do Poder 360 em Brasília em 18 de janeiro de 2024. Para ficar sempre bem informado, inscreva-se no canal do Poder 360, ative as notificações e não perca nenhuma informação relevante. A partir de agora, a entrevista será feita em inglês. Mrs. Hartmann-Boyce, thank you very much for talking with us.
Thank you for having me.
I know that, Mr. Hartmann, you had the opportunity to review many studies on e-cigarettes. I know your focus is in smoking cessation, but I would like to start asking if you could talk a little bit about what have been the strategies in terms of regulation of e-cigarettes in different countries, and which ones do you think that have produced the best results?
It's a great question. Different countries have had very different approaches to electronic cigarettes, and I think it's too early to say for sure what the best strategy is. I don't even know if there is a single best strategy globally. I think the considerations that go into it are very country specific. I think one of the important things to note is that the major potential benefit that e-cigarettes might have to offer is helping people transition away from smoking. So smoking traditional cigarettes, we know, is incredibly harmful and deadly. And we know that e-cigarettes, though not risk-free, are considerably less harmful than smoking. If you're in a country where hardly anyone smokes, then e-cigarettes are unlikely to benefit your population. If you're in a country, on the other hand, where you have a lot of people still smoking, a lot of people still dying from smoking, that might be a space in which you consider the regulation as opposed to the banning of electronic cigarettes.
In Brazil, here, though it's illegal to sell vapes and electronic cigarettes, there are over 2 million users. The industry argues that it would be better to lift the ban and regulate the market to avoid sanitary concerns about the substance that go into the cigarettes and to diminish the illegal markets. I wonder, what's your take on the subject?
It's not my job to say what Brazil or any government should or should not do in this space. I think the concerns about unregulated products are very legitimate ones. So we know that there are many, many stories of bad things happening to people when they use e-cigarettes. And when you dive deeper into those stories, a lot of those are unregulated kind of black market devices where people are tampering with what might go into the e-liquid. People might be familiar with a spate of lung injuries that happened in the US back in 2020 that were associated with vaping, and that was found to be with an additive that was being put into e-cigarettes that were largely unregulated ones. On the other hand, if you are going to go ahead and say, yep, we are going to allow e-cigarettes on the market, there's a number of really important things to consider. You know, regulation is a complex thing, and it's about having the amount of resource to regulate things properly. And it's also thinking about what markets e-cigarettes may or may not be appropriate for and how to control messaging and access to those markets. So it's not just about whether or not a product is commercially available. It's also thinking about, for example, the advertising, the placement of those products. So there are lots of things that would need to be considered in this discussion. And what I would say is that, you know, taking the view of looking at all the people who are dying from smoking every day, knowing that many adults who smoke want to quit and haven't been able to do so successfully, it leads us to understand more why some people might be pushing to have e-cigarettes available, and particularly in a way that might be regulated, if that regulation was effective at ensuring they were as safe as possible and also ensuring they were least likely to be picked up by people who are not going to benefit from them, with a key population here being young people who don't smoke.
What is the current state of knowledge of using electronic nicotine device like e-cigarettes to smoke cessation?
Yeah, so we actually have very good evidence that e-cigarettes with nicotine can help people who smoke quit smoking. I lead a Cochrane review on this topic along with a large team of colleagues. And every month we review all the studies that look at the role of e-cigarettes with nicotine in helping people quit smoking. And there are some very, very good trials that show definitive data that for people who smoke, using an e-cigarette with nicotine can help them move away from smoking. That's not a surprise. We know that things like nicotine gum and nicotine patches work to help people quit smoking. E-cigarettes are another way of delivering nicotine, but they're doing it in a way that also mimics some of the social and environmental and psychological cues that many people find hard to give up when they're trying to quit smoking.
There is a difference, though it's not clear if it's really better. Comparing, correct please if I am mistaken about it, but comparing e-cigarettes with nicotine to e-cigarettes with no nicotine. Why is that? The habit could have something to do with this effect of smoke cessation.
Yeah, so the evidence we have does suggest that using an e-cigarette with nicotine is more effective at helping you quit smoking than using an e-cigarette without nicotine. But we don't have that many studies testing that. We essentially need more studies to be more sure of that finding according to the framework that we use. But we know that even though using something like a nicotine patch or a gum is more likely to help you stop smoking than not using anything, lots of people have tried that and have not succeeded. And part of the reason for that is that addiction to smoking is a very complex addiction. It's not just an addiction that is purely driven by nicotine. Nicotine is the agent that's underlying that addiction and helping that addiction form. But for a lot of people, the process of, for example, hand-to-mouth movement with a cigarette, exhaling smoke, let's say going and standing outside or going for a smoke break with colleagues, all of that can also help feed into difficulties with quitting smoking. And e-cigarettes are something which are not only providing that nicotine, which is the pharmacological compound that people are addicted to, but they're also providing some of those same behavioral cues. And for example, there have been studies that have tested like people just sucking on plastic tubes to see if that helped them quit smoking, just because we know there are some really complex things going on in terms of people's behavioral cues that are helping reinforce tobacco addiction.
The conclusions of the review, the meta-analysis you did sound very straightforward, though we see that there is still some debate over it, and that WHO, for an example, in its web pages, still say that the evidences are inconclusive on the cessation provided by nicotine device. What is your take in this debate?
I come from a position of working for an organization, Cochrane, which evaluates all different sorts of healthcare interventions and evaluates them on the same set of criteria. And according to the criteria that we use in Cochrane, the evidence shows quite clearly now that e-cigarettes with nicotine can help individuals quit smoking. However, what someone like the World Health Organization is considering as our policymakers worldwide is not just what does that evidence show in individuals. They're thinking, what does this mean at a population level? And do the potential benefits of this at a population level outweigh the disadvantages? And when you think about disadvantages, one of the big ones that everyone is thinking about is youth uptake of vaping, especially when those youth would not have otherwise been using any nicotine products. So I think they are weighing that up. And it's also really important to note that the studies that we are looking at in our review are of people who are given e-cigarettes with nicotine and encouraged to use them to quit smoking, right? So they're being given to people who smoke with support as a quit smoking aid. That might be very different from the effect of someone buying an illicit product, which may or may not contain nicotine, may or may not be safe, and may or may not be encouraging them to quit smoking. So there's all different sorts of contexts and elements that an organization like the World Health Organization is considering. What we're looking at is when you look at the evidence, when you give people who smoke nicotine e-cigarettes, does it help them stop smoking? The evidence on that, I would argue, is very clear that it does.
You mentioned some data saying that the use of e-cigarettes is soaring amongst young people in many countries. I wonder what is the evidence right now about the effect of allowing e-cigarettes and having the young people smoking more e-cigarettes or being driven to nicotine in a way that they wouldn't if there was no e-cigarettes?
It's a good question, and I don't think we have really clear evidence on it. I think to some extent it varies country by country, but I also think most of the evidence we have on it is focused on very certain high-income countries in Western Europe and in the United States and Canada. What we know, I think, as a whole, based on the evidence we have now, is that it certainly seems that young people who use nicotine e-cigarettes, definitely a proportion of them are people who we would not have otherwise expected to be smoking regular cigarettes. What one of the big concerns is within the public health community is whether or not vaping or the use of nicotine e-cigarettes is causing more young people to then go on to smoke. But because we know that nicotine e-cigarettes aren't harm-free, but we know that smoking is really, really harmful, So we definitely don't want anything that is causing young people to smoke who wouldn't have otherwise. And by smoke, I specifically mean smoking traditional cigarettes. I don't mean vaping. And the evidence on that is hard to interpret. What we can see clearly is that young people who vape are more likely to go on to smoke than their non-vaping peers. But whether or not one of those things is causing the other is very much contested. And if we look, at a population level, let's say we're looking at a country like the US, where I am right now, where we've had a lot of young people using e-cigarettes over the years, a lot of young people using e-cigarettes with nicotine. If those were overall leading more young people to smoke, we would have started to see, we think, increases in youth smoking by this point. And in fact, what we see overall is more indicative of the opposite. So if anything, the evidence is starting to suggest that at a population level, it may be that vaping is replacing smoking for younger populations. But we also know there are populations who wouldn't have otherwise smoked who are vaping.
We have talked with WHO Director Hildegard Kresch, who argued that if a country wants to use e-cigarettes as a means to cease smoking, one thing that could help this country to regulate it is to regulate its like a prescription drug, so to be sold only in pharmacies with prescription and no flavors at all. What's your opinion on this sort of measure in order to try to control this market?
I think in an ideal world, having an e-cigarette with nicotine available on prescription would be a great thing. It would hopefully encourage medical professionals to talk about it with their patients. It would hopefully encourage use of e-cigarettes with nicotine as a way to help people quit smoking. Whether or not those devices be flavored or not, if they were on prescription, I think is another question. Like, I have young kids, a lot of their prescription drugs taste nice, and that's actually quite helpful. So it's not actually that all of our prescription drugs are unflavored. But I think there are challenges in restricting only to having e-cigarettes available as a prescription product. Those challenges are many. They include actually getting someone to get an e-cigarette through a licensing process as a medicine, which is a very expensive and lengthy process. And would be very difficult for an independent vaping manufacturer to do, but much easier for a tobacco industry route. And I think the other thing to remember is that when it comes to accessing medications and treatments, it depends on a country's healthcare system, but that might be difficult. So if we put things behind, for example, a prescription in a country where a lot of people who are low income don't have access to healthcare, that is going to create some problems. And in many countries, it is those people, particularly the people with lower incomes, who are more likely to be smoking and more likely to potentially benefit from e-cigarettes. And I think the final thing to consider here is if we are thinking about e-cigarettes in relation to smoking, and all of our evidence suggests that e-cigarettes with nicotine are substantially less harmful than smoking, it is not providing a particularly clear message or clear incentive structure to people who smoke that they should be switching to e-cigarettes if they can't access an e-cigarette without a prescription, but they can go into a corner store and buy a cigarette without a problem. So I think we also need to think about how we encourage people to switch away from doing the most harmful behavior in this spectrum, which is smoking combustible tobacco, onto less harmful alternatives. And there's a range of policy options, and different countries will choose different options based on their populations and their various regulations that are already in place.
I would like if you please to keep the conversation on this topic about harm reduction. What are the evidence right now we have of harm, of lowering the harm comparing e-cigarettes to the regular ones? Is that good evidence we have right now? The switching of one sort of smoking to another can be beneficial to the user?
Yes, so the evidence we have shows that in people who smoke, switching to nicotine e-cigarettes, and particularly when they switch completely, so they're no longer smoking combustible tobacco and they're only using nicotine e-cigarettes, reduces the levels of a lot of the harmful things that we might see happening in people's bodies when they're smoking. There are many international consensus statements which conclude that overall there's good evidence to suggest that though not risk-free, e-cigarettes are considerably less harmful than smoking. That is not to say that e-cigarettes are safe. The thing we are comparing them to is something that kills 1 in 2 people when used as intended. So cigarettes, when used as intended, will kill 1 in 2 people who use them in the long term. And we are comparing a product which is not risk-free but is safer than that. Now, one of the real challenges within that, however, is that as we know, and as anyone who's kind of seen e-cigarettes knows, not all of these devices are the same. So it can be really difficult to make overarching statements about safety. The e-cigarettes that might be illicit, that might be tampered with, that might have things in that are e-liquids that should definitely not be inhaled, those might be very harmful. Whereas an e-cigarette that's tightly regulated, that's been approved for use as something that people could use to reduce harm, where the ingredients have been tested and been guaranteed, that is likely to be very, very much less harmful than smoking. So there's not only a spectrum in terms of tobacco and nicotine products, but there's also a spectrum in terms of the type of e-cigarettes that might be available to people and the different harm profiles within those.
Do you think that we still need more studies on e-cigarettes to know if there are more potential dangers of using them? What's the state of knowledge about that? Or
absolutely. So we absolutely need more studies looking at the safety and health effects of e-cigarettes. We need those both in the long term. So we need those in people who vaped for a long time. And traditionally that's been a difficult thing to do, because if you went back 10 years, it was very difficult to find people who vaped who had never smoked. But now we do have people who vape who have never smoked. And so particularly looking at health outcomes in that population over the longer term will be really useful. But even short-term studies can tell us a lot at the moment. And the reason why those short-term studies are important is not that we don't have them. There are hundreds upon hundreds upon hundreds of shorter-term studies looking at the potential health effects of e-cigarettes, but the fact that the technologies are changing all the time. So as new devices become available, they may well have different safety profiles, and that will be something that we need to continue to study. And because of all of these unknowns, I'm not aware of anyone suggesting, and I certainly would not suggest, that anyone who doesn't smoke should ever use an e-cigarette. That is not likely to do them any good whatsoever. However, for people who smoke, who are struggling to quit, and particularly who are struggling to quit using the other things available to them, e-cigarettes with nicotine, the evidence is showing, are a viable option to help them move away from the most harmful product.
So, Mrs. Hartmann-Boyce, we are reaching the end of the interview. I'd like to thank you again for your time, and would like to ask you if there is any final remark you would like to share with our audience.
Thank you so much. I suppose in terms of final remarks, it's just worth really hammering in on the fact that when we think about regulating e-cigarettes, we are thinking about so many different things and so many different populations and people. And the reality is that whether or not an e-cigarette is likely to harm or benefit you depends partly on you. So whether or not you smoke, if you are someone who smokes, using a regulated nicotine e-cigarette may well benefit you. And it also depends on the e-cigarette you're getting. It is not going to be the same to buy a regulated e-cigarette that is past product and safety standards as it is going to be buying something that you don't know where it came from and you don't know what's in it.
Chega ao final esta edição do Poder Entrevista. Em nome do jornal digital Poder 360, agradeço também a todos os espectadores que assistem a este programa. Essa entrevista foi gravada no estúdio do Poder 360 em Brasília em 18 de janeiro de 2024. Para ficar sempre bem informado, inscreva-se no canal do Poder 360, ative as notificações e não perca nenhuma informação relevante. Muito obrigado e até a próxima.
Poder Monitor, a ferramenta mais completa para monitorar os 3 poderes. Acesse agora poder.cc/monitor e ganhe 30 dias grátis.